I'm an orthopedic surgeon, and I have the task of taking care of trauma patients. Let's take distal humerus, for example. Distal humerus is a very tough, often comminuted, high-energy injury. Sometimes you have to go in and do electron osteotomy, you have to open everything up, you have to piece together everything, and it is a process. Well, the first step to that surgery is finding the ulnar nerve and moving it up. The ulnar nerve is a finicky nerve. When the ulnar nerve goes down, it's very debilitating. You lose the intrinsic function of your hand, you go into claw, you lose the sensation. Very debilitating. The first step of that procedure is to find the ulnar nerve and move it out of the way. And then you go through this hour or two process of repairing the distal humerus, which is often comminuted. You got plates going everywhere, headless screws everywhere. And then you do an osteotomy. You spend 2-3 hours sometimes putting everything together, and you got this ulnar nerve sitting there, which that patient's outcome is going to be heavily based on the function of that nerve. While you can live with a stiff elbow, you really can't live with a deformed ulnar nerve. In that situation, I want to show that prophylactically we should be protecting that nerve. This is a high trauma injury, a lot of scar tissue, and when you recover from that, that can produce a lot of scar tissue around the nerve, which can cause dysfunction. So I think in that setting, you should really bias the nerve and take everything you can at your disposal to protect that nerve from being scarred too postoperatively. So that's a situation where I would show that given the high onset of ulnaritis, which is very prevalent after a distal humerus or even a total elbow, prophylactically wrapping the nerve in a study that I'm doing now, you'll show that you would likely decrease the prevalence of ulnar nerve, because no one wants to go back in a surgery like that and explore the ulnar nerve. I do not want to inherit that cost, which is a mental cost on anybody and the patient. So even if it costs a few $1,000s, you add that wrap, everyone's going to win in that situation.